Good day. I am John Polardenio, and today we are going to discuss about common pathogenic microorganisms specific to gram-positive cocci. We are going to tackle about Staphylococcus, including the strain it has, the disease they cause, and the common treatments we have. So Staphylococcus are classified under gram-positive cocci. Now, let's discuss some characteristics of Staphylococci. First, Staphylococci appears to be grape-like in clusters, and they are also known to produce an enzyme called beta-lactamase. Staphylococci are one of those bacteria that are classified to be penicillin resistant. Also, Staphylococci can be grown using a mannitol salt agar at about 7.8% of salt. Why? Because Staphylococci are salt tolerant at about 10% of salt. Also, Staphylococci are normal microflora of our skin. It includes Staphylococcus epidermidis and Staphylococcus aureus. The identification test for your Staphylococcus strain is your coagulase test, where Staphylococcus epidermidis is a coagulase negative Staphylococcus, while your Staphylococcus aureus is a coagulase positive Staphylococcus. Now, let's discuss the first strain of our Staphylococcus that causes diseases to humans, the Staphylococcus aureus. The characteristic of Staphylococcus aureus includes, as I said, they are coagulase positive, and they are one of those pathogens that causes nosocomial infections or escape. They produces gold pigments in sheep blood agars. And also, some strains of Staphylococcus are resistant to penicillinase-resistant penicillins and cephalosporins. Staphylococci secretes wide spectrum of diverse extracellular proteins which renders bacterium virulent. Now, let's discuss the diseases caused by Staphylococcus aureus to humans, including the available treatments and the manifestation of these diseases. The first disease caused by Staphylococcus aureus to humans is the staphylococcal scalded skin syndrome, or also known as Ritter's disease. So Staphylococcus aureus produces this toxin called exfoliative toxins that causes the loss of cell-to-cell adhesion in our most superficial epidermis. So Staphylococcus aureus exfoliative toxin is serine proteases. When you say serine proteases, these are enzymes that cleave peptide bonds to proteins, in which they serve as nucleophilic amino acid at the active sites. The early manifestation of this disease includes fever, lethargy, poor feeding, and malaise. Also, these symptoms are followed by erythematous rash and fluid blisters or large fragile fluid blisters, which these blisters once popped up or burst out, it will leave our skin uncovered with epidermis. Also, we have this type of scalded skin syndrome called bullous impetigo. Bullous impetigo differ only from staphylococcal scalded skin syndrome with the extent of their skin damage, because bullous impetigo is localized staphylococcal scalded skin syndrome. So if asked, what are the treatments we can have for this type of disease caused by Staphylococcus aureus? So we have IV antibiotics, also penicillinase-resistant penicillins, or our staphylococcal antibiotics including napsilin, flucloxacillin, cephalosporin, and clindamycin. So those are the antibiotics that can fight back or that can kill Staphylococcus aureus. The second disease caused by Staphylococcus aureus is called toxic shock syndrome. Staphylococcus aureus produces this toxin called TSST1, responsible for the occurrence of toxic shock syndrome. This disease is also associated with septic shock, where patient may suffer from severe organ failure or severe organ damage, including acute respiratory distress or acute renal failure. The third disease caused by Staphylococcus aureus is acute endocarditis. When you say acute endocarditis, this is the inflammation of the heart or the inflammation of the heart valve. The fourth disease caused by Staphylococcus aureus is food poisoning. Food poisoning is one of the most common cause of our gastroenteritis from food intoxication. So Staphylococcus aureus produces this toxin called enterotoxin, responsible for the occurrence of our food poisoning. So example of food associated with food poisoning is our mayonnaise found in our sandwiches. So how? Once the bacteria manifested our wounds, example in wounds in our finger, and this wound comes in contact with our food or sandwiches, the Staphylococcus aureus will produce this enterotoxin that will contaminate that food, that will cause our gastrointestinal problems. So symptoms may include abdominal pain, fever, diarrhea, nausea and vomiting, and malaise. The fifth disease caused by your Staphylococcus aureus is your skin boil, pig sack, or your furuncles. It is where our hair follicles are being infected with Staphylococcus aureus. There are two treatments available. Either the doctor can make a small cut to allow the pus to drain and wound will heal naturally, or you can use antibiotics at certain situations. So those people who try to pop their skin boils by their own develop the risk of infections spreading inside their body and leading to more complications. Also, we can use ammonium bituminosulfonate with a brand name of itch thiol, or also known as your drawing salves. This will speed up the production of abscess inside that boils, allowing it to drain and heal naturally. So the sixth disease is called impetigo. Impetigo is characterized by red patch with pus and crust. It is mostly found in our lips and it is highly contagious. Then, the seventh disease caused by Staphylococcus aureus is our folliculitis. When you say folliculitis, Staphylococcus causes the inflammation of our hair follicles. Also, we have sty as the eighth disease caused by Staphylococcus aureus. In our term, this is called thymus. It is a type of folliculitis found in our eyes. Next disease is your carbuncle. Carbuncle is several boils coalesce forming one infection that produces a white discharge, meaning they settle in one area producing a discharge. The 10th disease caused by Staphylococcus aureus is osteomyelitis. Osteomyelitis is the infection of our bone marrow. So this usually occurs for boys under 12 years old. The 11th disease caused by Staphylococcus aureus is pneumonia. Staphylococcus aureus are rare but very severe cause of community-acquired pneumonia. And if it happens, this is very violent and destructive that sometimes causes effusions and emphysema. Also, Staphylococcus aureus can cause septic arthritis. Staphylococcus aureus affects our bones, and without prompt treatment, this will cause a permanent loss function of our joints. Lastly, we have wound infection. So Staphylococcus aureus invades our wounds, and if it happens, especially those sutured wounds, is required to be opened again and let it heal while it is open, because Staphylococcus will produce this abscess and cellulitis in sutures. Now, let's move on to the next strain of Staphylococcus. We have Staphylococcus epidermidis. Staphylococcus epidermidis is also known as accidental pathogen. It is also a normal bacterial flora that is widely found in the body at about 90%. When you say normal bacterial flora, these are microorganisms that lives in another living organism without causing disease. But unlike Staphylococcus aureus, Staphylococcus epidermidis are coagulase negative. Now, let's discuss the bring about infections of Staphylococcus epidermidis. First in the line, Staphylococcus epidermidis causes infection in fully urine catheters and intravenous lines. So, epidermidis travels through those linings and infects those patients having catheters or intravenous lines. Next, the stitch abscess and sepsis. So, Staphylococcus epidermidis may infect our stitches, and if that happens, those sutures will be reopened again and heal while it is open. And the doctor must use a sepsis way in order to avoid further infections caused by Staphylococcus epidermidis. Lastly, we have frequent skin contaminants or blood cultures. Determining the presence of Staphylococcus epidermidis is by drawing a sample from different parts of our skin. And if that two cultures are positive, then the likelihood of bacteremia with Staphylococcus epidermidis is high. The last infection caused by Staphylococcus epidermidis is the infection of prosthetic devices. Staphylococcus epidermidis have these polysaccharide capsules that allows them to adhere to some prosthetic devices that are inserted to humans. Prosthetic devices includes prosthetic heart valves, prosthetic joints, and also peritoneal dialysis catheters. So, since Staphylococcus epidermidis are also antibiotic resistant, we use vancomycin in order to kill this kind of bacteria. Now, let's move on to the last strain of our Staphylococcus. We have Staphylococcus saprophyticus. Staphylococcus saprophyticus is the second leading cause of our urinary tract infection, and it usually affects women, especially those are sexually active young women, at about 95%. So those are the strains of Staphylococcus and the diseases they cause, mentioning also the treatments we have today in order to combat their pathogenicity. So that's all, and thank you for listening.